Hey future nurses, in this lesson, we're breaking down the cardiovascular system, one of the most vital and fascinating systems in the body. We'll talk heart structure, blood vessels, hormones, common labs, and even what to expect during heart procedures. Grab your coffee, get comfy, and let's get into it. First things first, the heart. So where is it? Right in the middle of your chest, in an area called the mediastinum. It's surrounded by a pericardial sac that has 3 layers. Think of it like a protective envelope. The tough fibrous pericardium, the slippery parietal layer, and the visceral pericardium, which hugs the heart directly. You might also hear it called the epicardium. Between those layers is a small amount of fluid that helps the heart glide smoothly with each beat. Quick anatomy check. The heart has 4 chambers. The top 2 are the atria, and the bottom 2 are the ventricles, and it has 3 layers in its wall. Epicardium outer, myocardium muscle, endocardium inner lining. A good way to remember: EME, epic, mighty, enduring. It also has 4 valves that make sure blood flows in the right direction. Tricuspid right side, pulmonic, mitral left side, aortic. Try this mnemonic: toilet paper my asterisk, tricuspid, pulmonic, mitral, aortic. It works. You won't forget it. Asterisk. Let's talk about how the heart beats. The electrical system starts in the SA node. That's your natural pacemaker. Then the impulse travels to the AV node, down the bundle of His, splits into the right and left bundle branches, and ends at the Purkinje fibers, which cause the ventricles to contract. Think of it like a well-timed relay race. Every part passes the signal to the next. Cardiac output. This one's important. Cardiac output CO is the amount of blood pumped out by the left ventricle in 1 minute. You find it by multiplying stroke volume times heart rate equals CO. Ejection fraction is another key number. It tells us what percentage of blood gets pumped out with each beat. Normal is 55 to 70%, less than 40%. That's a red flag for a heart failure. Hormones in your heart. Epinephrine gives your heart a boost, increasing heart rate and force. Aldosterone helps with sodium and potassium balance. Atrial natriuretic peptide tells the kidneys to get rid of sodium, and with it, extra fluid. Now let's talk vessels. Arteries carry blood away from the heart, usually oxygen-rich. Veins bring blood back to the heart. Capillaries are where gas and nutrient exchange happen. Blood pressure is the force of blood on your vessel walls. Normal is less than 120/80ths. Ever heard of the RAAS system? That's renin-angiotensin-aldosterone, a hormonal system that helps control BP. Important to know for hypertensive patients. Circulation comes in 2 types: pulmonary circulation, heart to lungs and back; systemic circulation, heart to body and back. Aging and the cardiovascular system. As we age, things change. Arteries harden, atherosclerosis. Blood pressure creeps up. Valves get weaker. The heart isn't as efficient, and arrhythmias become more common. This is why cardiac assessment is so important, especially in older adults. Assessment: what should we look for? Start with subjective data, symptoms, medical history, meds, allergies. Use the What's Up method to explore symptoms, then move to objective data, vital signs, including orthostatic BP. Watch for dizziness and fall risk. Pulse quality. Check for pulse deficit, edema, skin color, jugular vein distension, capillary refill, and clubbing. And always remember the 6 P's of poor perfusion: pain, pallor, pulselessness, paresthesia, paralysis, poikilothymia, cold limb. Now, let's listen. Heart sounds. S1 and S2, normal. S3 might indicate heart failure. S4 often with stiff ventricles, murmurs, swishing, or hoarshing. Pericardial rub sounds like a leather squeak from inflamed pericardium. Lab tests. Know your cardiac markers. Troponins are the go-to for heart attacks. They rise within 3 to 4 hours of injury. CK, CKMB, and myoglobin help confirm muscle damage. CRP and homocysteine point to inflammation and cardiac risk. Lipid panel tells you about cholesterol and triglycerides. Make sure the patient fasts 12 to 24 hours. Electrolytes matter. Sodium, fluid balance. Potassium, heart relaxation. Calcium, heart contraction. Magnesium, keeps rhythm steady. Low or high levels can lead to arrhythmias, so monitor closely. Non-invasive diagnostic tests. Chest X-ray size and shape of the heart. CT and MRI, heart structures. Echocardiogram, shows how much blood is pumped out. Stress tests, exercise or chemical induced. Holter monitor, 24 to 48 hours ECG at home. Tilt table test, checks for syncope. Invasive tests. Angiography, checks arteries using contrast dye. Cardiac catheterization, evaluates blood flow and heart pressure. Electrophysiology study, finds where arrhythmias are starting. Pre-test, NPO, consent, check allergies. Post-test, bed rest, monitor site, pulses, and watch for chest pain or bleeding. Therapeutic interventions. Encourage exercise, smoking cessation, healthy eating, and weight control. Use anti-embolism devices like TED hose properly. No rolling or bunching. Apply medications wisely. Antihypertensives, anticoagulants, cardiac glycosides, thrombolytics, and more. Cardiac surgery. What to know before surgery? Check pulses. Stop certain meds: aspirin, warfarin, heparin. Control glucose. Prep the site, usually groin. After procedures using the femoral site, patients should lie flat for up to 8 hours to prevent bleeding. And that's a wrap. The cardiovascular system is complex, but when you break it down, it becomes manageable. Think in terms of flow, rhythm, and function. Stay curious, ask questions, and keep building your confidence. Thanks for learning with me. Keep that heart knowledge strong. And I'll see you in the next lesson.